A 50-year-old male complaining of red eyes. He can wake up with the lids stuck together, with no history of pain or photophobia or itching. The visual acuity of both eyes were normal, and examination showed discharge in the inferior fornix of each eye, with no periauricular lymphadenopathy. The following examination. Assalamu alaikum jama'a, ma'akum Nawaf Salah. And just like you guys said, or just like you guys saw in the video, today we're going to be talking about conjunctivitis, and we're going to apply it clinically as much as possible. So as you saw in the clip previously, whenever a patient comes to you in the clinic, regardless of whether you're going to be an eye doctor or not, is going to come with these presentations. So the question we want to ask ourselves in this case is, what is the diagnosis? Why is this a diagnosis? What are the differential diagnosis, investigation, and treatment بشكل مختصر, in a summarized view in a way, okay? So regarding the diagnosis, this diagnosis, we're going to consider it as bacterial conjunctivitis, okay? Bacterial conjunctivitis. Now, conjunctivitis means, as you know, inflammation of the conjunctiva, the visible vessel on your sclera. And inflammation of the conjunctiva is typically caused due to either an infection or due to a non-infectious cause such as an allergy. So we're going to consider this as one of the three main types of conjunctivitis, which is bacterial conjunctivitis. Now let's talk about in general, why do we assume that this patient most likely has conjunctivitis? Let's go away from the case and think in general. Typically in people with conjunctivitis, they tend to have the key word, redness in their eye. In some books, they say conjunctival injection, the same thing. So they have redness in their eye because these blood vessels, when they're inflamed, they tend to dilate and you have hyperemia. Along with that, their visual acuity, meaning their ability to see distant vision in both eyes, are normal, which is quite weird. You would think conjunctivitis, their vision would be affected, but it's not. It's completely normal vision. And that's one of the ways, by the way, to distinguish it from keratitis, when we see in future videos. Along with normal visual acuity, they'll have a discharge, and the discharge will depend on the type. Is it watery, or is it purulent, pus, or is it mucopurulent, mucoid and pus? Along with discharge, or sometimes they call it tearing in watery discharge, along with these, they'll have a burning sensation, meaning they'll feel pain in their eye, or they sometimes call it foreign body sensation, the same thing. Along with that, they'll have a fear of light. Like I have a light in front of me. If someone with conjunctivitis were to be exposed to this light, they will squint their eyes immediately in reaction because they're very sensitive to it, okay? Photophobia, that's the meaning of it, as well as chemosis. Chemosis means swelling of the conjunctiva. You might see swelling in the conjunctiva with or without edema as well in the lid. So chemosis means swelling in the conjunctiva itself. So all of these symptoms, when a patient comes to you, you will think of conjunctivitis as the most likely cause. Now, what are differential diagnoses of conjunctivitis? Other causes of red eyes. Typically, when people think, whenever we have red eyes, we think of conjunctivitis. That's not the only cause of red eyes. Redness. Conjunctivitis is the most common and most likely cause, but there are other causes as well. And we'll talk about it in future videos when we summarize it. But typically, other conditions that can cause red eye, as an example, can be episcleritis, which is inflammation on the outer layer of the sclera, or scleritis, inflammation of the sclera itself, associated with autoimmune diseases like rheumatoid, or cases of keratitis, or cases of endophthalmitis. We're now talking about serious conditions, so we'll talk about that in future conditions. When we talk about the idea here is that when we think of differential diagnosis, we want to think of other causes that might cause redness in the eye. So, okay, Nawaf, before we go to investigations, I said this is bacterial conjunctivitis, okay? Now, of course, in bacterial conjunctivitis, we have to distinguish bacterial conjunctivitis from other types. And we also need to know which type of bacterial conjunctivitis. Could it be a typical staph infection, which is most commonly the cause? Or could it be, especially in the case of children, a case of chlamydial conjunctivitis? Is this a case of chlamydial conjunctivitis or trachoma in children? Is this a case of gonococcal conjunctivitis, especially in babies? Babies, they might have a case of neonatal conjunctivitis, goes by gonorrhea, sorry, not gonococci, gonorrhea, as well as chlamydia. All right, so we need to distinguish that. So I made a simple table to distinguish all the types from bacteria among themselves as well as compared to viral and allergic. So in the case of red eyes, all of them have red eyes, all right, in bacterial, viral, and allergic conjunctivitis. But there's a key difference in the discharge for each of them. For example, in bacteria, as we said, the discharge will be purulent. So it will be either yellowish or mucopurulent. There's some bacteria that will give you pure pus, meaning yellow, meaning no mucoid, such as gonorrhea or chlamydial infections. But we'll assume there's purulent discharge or mucopurulent discharge, and most of them in bacterial conjunctivitis. But in viral and allergic, there will be water, meaning watery discharge or lacrimation in both of them, okay? So in viral and allergic, there will be watery discharge. So what about this thing, pre-auricular lymph node? Pre-auricular lymph node meaning enlargement of the pre-auricular lymph nodes in this area. And this can be a specific sign of viral or allergic conjunctivitis. Now, in the case of viral and allergic, there will be enlargement of the pre-auricular lymph node. In bacteria, no. There is no auricular lymph node enlargement except in one specific bacterial agent, which is in chlamydia. So if you have a case of chlamydial conjunctivitis, you might have a case of pre-auricular lymph nodes. But let's say I have conjunctivitis due to Staph aureus or Streptococcus pneumoniae. No, it's not going to be a case in here. So that's why when we look at a case of bacterial conjunctivitis and we want to specify what it might likely be, we have to look at these symptoms. Is it pus? Is it pre-auricular lymph node? Red eyes? The history, past history, how you might have got this infection, and so forth. The next one is itching. Now, itching meaning, along with these symptoms, you have itching. The eye becomes very itchy. You tend to rub your eyes constantly. And in this one, you'll only find this in allergic and not in any other type of conjunctivitis. In allergic conjunctivitis, itching is the hallmark of allergic conjunctivitis because an allergy, you have an allergy, and one of the ways of having allergy is in your eyes, especially exposed to dust, let's say. So you start to rub your eyes constantly. So itching is a complete hallmark in allergic conjunctivitis and not found anywhere else. Besides that, there's family history, or let's say past history, okay? In bacterial conjunctivitis, they might have a past history of, let's say, sinusitis, or any bacterial infection from before. Any respiratory tract infection, let's say. Or let's say they have a case of STD, and let's say like chlamydia infection, and they accidentally rub their eyes with a dirty hand in their genitalia to their eyes, so they might have in that transmission, a case of chlamydial conjunctivitis, especially in adults. So you might have past history of transmission in sexual, or it could be a case of sinusitis. In viral, they might have a past history of upper respiratory tract infection. So a patient may come to you with past history of fever and sore throat. That might give you an idea of the diagnosis of viral conjunctivitis. And in allergic conjunctivitis, you might have a past or family history of allergic disorders. So we can think of a case of asthma, atopy in the family, contact dermatitis, any kind of allergic disorder might give you an idea as a past history of allergic conjunctivitis. So, and the last thing to distinguish all the differences is the causative agent. The most common cause of bacterial conjunctivitis بشكل عام is Staph aureus, okay? It's SA. But we should be wary of other causative agents, especially in children, which is chlamydia, trachomatis, or chlamydia in general, the bacteria, which is an obligate intracellular parasite. It relies on other cells to survive. And chlamydia, as we said, is going to be very important because it causes two types of conjunctivitis. In adults, it's adult inclusion conjunctivitis. This is the conjunctivitis that occurs in patients with very extensive sexual history, unprotected sex. So they tend to have STD along with that. And typically they just come in with some of these symptoms, and they may come with mucopurulent discharge. So it's not too serious. We just have to give them topical antibiotics. But in the case of chlamydial infections in children, this is very serious. And this is caused by a serotype chlamydia A, B, and C, and children known as trachoma. This is a very serious type of chlamydia, and this is by far the most common cause of preventable blindness all over the world, especially in children in Africa, where if there is no patient education running in the family, And they might get this infection from a fly, they might get this infection from crowded conditions, and in children, typically chlamydia can cause trachoma, which is basically conjunctivitis, but it is characterized by corneal scarring. Eventually, if trachoma or chlamydia, conjunctivitis in children, which is trachoma, if it's not resolved, it can lead to permanent blindness because over time it will lead to scarring of the cornea. And if there's scarring of the cornea, light will not be able to pass through as easily as it did before. Okay? So this is a very, very important condition that we need to keep in mind. All right? Causative agents for viral, the most common is adenovirus. And if you notice, adenovirus is basically the same virus you'll see in upper respiratory tract infection. This is the most causative agent of viral. Allergic, anything. Like I said, it could be associated with an allergic condition. So it could be any allergy, as we said from above, in this one as well. So it could be anything. So this is a summary of a table that will allow you to distinguish between the three types of conjunctivitis. And if you want an extra feature, you will see, especially in allergic conjunctivitis, besides itching, you'll see something called here, we will call it as cobblestone papillae. Cobblestone papillae. Basically, when you look at the vesicle sclera, if you look it up here, you might see presence of papillae, as if the cornea itself. You'll see presence of these papillae of the cornea as if they're arranged in cobblestones. They're not exclusive to allergic conjunctivitis. You might see this in contact lens users that wear contact lens for a long period of time. But this is another feature you might see in allergic conjunctivitis. Okay? So this is a table to distinguish between the three. And in our case, we'll see bacterial conjunctivitis and the reasons why. Differential diagnosis, anything that causes red eye. Investigation in general, you'll do full ophthalmic examination. If you're an eye doctor, typically, here, if you're a general practitioner, I'll give the patient some ointments and some topical antibiotics and refer them to an eye ophthalmologist. The eye ophthalmologist will do a full eye examination. We have a device called the slit lamp. He'll examine the eye especially, and he will take a swab from the conjunctiva. They call it conjunctival swab for culture sensitivity testing. And then from that testing, they can determine what kind of bacteria might be in it to determine the optimal topical antibiotics. Besides that, they can also do blood culture if need be. Okay? Once they get the investigation, once they finish with that, they will do the treatment for conjunctivitis according to the cause. In bacteria, we'll typically do ointments for the eye as well as lid hygiene and topical antibiotics. Let's say macrolides like tetracycline or zeromycin, especially in the case of chlamydia conjunctivitis. Okay, so we'll typically use topical antibiotics. In general, also in any infection, warm compressors as well. In the case of viral, it tends to be self-limited. We just have to give supportive therapy. In the case of allergic, typically you treat the cause. It could be an exposure to an allergen that might have caused this, so you typically treat the cause or what might have led to an allergic reaction. Okay? So this is a treatment for this condition, and that's the end of the video. I hope you enjoy.